Dude, you won't believe what happened during my eye surgery.
Dude, what the heck?
I heard they use cocaine on your eye.
Why would they use cocaine on my eye?
Actually, it's totally possible that your doctor decided to use cocaine as a topical anesthetic, especially considering you got your procedure done on your eye. The vasoconstricting properties, combined with the anesthetic properties of cocaine, have been said to be unmatched by any other drug, according to the American Academy of Otolaryngology.
No way, how does that work?
So how this works is that cocaine blocks the initiation of the nerve impulse from where it was applied. When cocaine is diluted down to a 1 to 4% solution, it does not have the same psychoactive effects on the brain. It has also been found that the ingestion of cocaine via a nasal route, another mucous membrane, has faster absorption into the body and it enhanced the effects compared to if it was orally ingested. The more blood vessels available, the quicker the transportation of cocaine is to the brain.
So my doctor used cocaine as an anesthetic. Has it been used for anything else?
So to understand the usage of cocaine, it's imperative to know its history. The first usage of cocaine dates back to around 4,000 years ago with the Incas. Cocaine naturally occurs in the coca plant, which is indigenous to the Andean mountain range in South America. Cocaine naturally occurs as an alkaloid in these leaves. The Incas used these coca leaves for a variety of purposes, one of them being religious. So in their religious ceremonies, they believed that chewing the leaves helped connect their spirits to the gods. Because of this supposed connections, the Incas also left the leaves at burial sites to help the dead in the afterworld. It was also used by those workers in silver mines in the 1400s to overcome the pain, fatigue, and respiratory problems that comes along with hard labor and the high altitudes in the Andes Mountains. This led to one of the first attempts at banning cocaine because the Spanish conquerors wanted to Christianize the natives and ban their religious practices. However, this failed predominantly because without the effects of the coca leaves for the miners, production slowed down and all the Spaniards wanted was silver and glory. The coca leaves were hard to transport, so cocaine never had dominance in the global market. However, this all changed when cocaine was first isolated as a salt, cocaine hydrochloride, over 120 years ago by Albert Niemann. The isolation of cocaine into a salt made it so that cocaine could be packaged and distributed worldwide. This form of powder cocaine turned out to be 100 times more potent than the leaf form of cocaine. Today, when cocaine is illegally sold in the United States for recreational purposes, it is often diluted with other drugs such as amphetamines or lactose, so it is not this strong. Niemann's work was then carried on by Wilhelm Lawson, who finally determined the molecular formula for cocaine. The molecular formula for cocaine is C17H21NO4. It has a molecular mass of 303.358 grams per mole. Cocaine was first used as an anesthetic in 1884 after its anesthetic properties were noted by Albert Niemann. August Bier, a German surgeon, then used this information to successfully operate on the lower extremities via the cocainization of the spinal cord. The patient reported to have pain relief within 5 to 10 minutes. Cocaine then became a popular cure for a multitude of things, including toothaches, asthma, and mountain sickness, especially because it could be purchased without any prescription. Cocaine-laced drinks for health purposes were all the rage, and Pope Leo even endorsed a cocaine and wine mix called Vin Mariani. Many of you may know that cocaine was also used in Coca-Cola. Coca-Cola's name came from its two main ingredients, cocaine from the coca leaf and caffeine from the cola nut. Coca-Cola was created by John Pemberton and it contained 60 milligrams of cocaine. This became a popular drink, and although it only sold about 9 drinks a day when it was first invented, by the 1900s it was a very popular drink. Cocaine was also used during the American Industrial Revolution following the Civil War during the Gilded Age to peak workers' efficiency in factories, much like how the Incas used it while they were mining for silver. Cocaine was further popularized by Sigmund Freud, a famous psychologist and the father of psychoanalysis. He advocated the use of cocaine as a way to mitigate pain, both from physical injury, and saw it as a way to overcome a morphine addiction. Freud saw it as a drug capable of curing most modern life ailments, which included low spirits and fatigue. Freud wrote his first big publication, Über Coca, about cocaine.
What about cocaine now?
Cocaine is no longer present in Coca-Cola, although it's still in the name. And cocaine is no longer able to be purchased by everyday people, and prescriptions for cocaine are no longer written. Cocaine was officially outlawed under the Harrison Narcotics Act of 1914. The act banned the sale and distribution and usage of coca and opium products. This act was said to be racially motivated because many people at the time believed that black cocaine users were going to be exceptionally dangerous. However, the true effects of cocaine have now been extensively researched, and the dangers of cocaine addiction are much better understood, so the outlawing was inevitable. Currently, under the United States Drug Enforcement Administration, cocaine is classified as a Schedule II drug. A Schedule II drug is one that has a high potential for abuse, but still has legitimate medical purposes. Other examples of Schedule II drugs include hydrocodone, which is commonly known as Vicodin, methamphetamines, oxycodone, Ritalin, and Adderall.
Wow, there's so much history about cocaine. Is there anything that it can be used for besides that?
So, although cocaine has had a very rich history and it's been used in the past for a lot of things, there's still further research that can be done with cocaine. For example, currently there is no Food and Drug Administration approved treatments that exist for cocaine abuse, addiction, and overdose. The development of effective treatment for this kind of addiction can be further extrapolated to other addictions and may help. The things that have been blocking finding an effective treatment for addiction of cocaine has been frustrated by the complex neurochemistry of cocaine as an inhibitory blocking agent. Nevertheless, within the past decade, immunotherapy for cocaine abuse has been evaluated in preclinical and human clinical trials, so research for that is ongoing. Something interesting is that there are now mice that have never learned to be addicted to cocaine.
Scientists accidentally created cocaine-proof mice. Apparently, the little guys never got hooked in the first place because the part of their brain that deals with the reward circuit was clogged. Mice in this experiment were genetically altered and given the drug repeatedly. According to researchers, the engineered mice didn't keep going to the area of the room where they were given cocaine the way other mice usually do. Instead, they couldn't be bothered with it and explored the cage. Happened every time. That means the mice never learned to crave cocaine. The findings are published in the journal Nature Neuroscience. Researchers hope to be able to treat addiction one day by changing how learning occurs in the brain.
Understanding the genetic code that goes into these mice will be further used to help treat addiction and understand how stimulants work in the body. Neurotransmitters and neurotransmitter inhibitors are still widely unknown and not well understood by scientists, so by being able to use cocaine, which is highly addictive, it gives scientists a way to use one extreme to understand things better in the brain. So this kind of research is what's going on with cocaine currently.
So what does cocaine do to my brain?
So cocaine, when it's in the brain, acts as an inhibitor of the reuptake of neurotransmitters. What happens is that cocaine as an inhibitor affects three naturally occurring chemicals known as neurotransmitters in the brain. These three neurotransmitters include serotonin, dopamine, and norepinephrine. Dopamine released elicits feelings of reward and pleasure. Serotonin influences mood, appetite, anger, and it affects sleep cycles, body temperature, and blood pressure. Adrenaline is what triggers the fight or flight response in the body. These three neurotransmitters are released whenever cocaine is ingested, and they are usually reabsorbed after release, but cocaine inhibits this reuptake. Reuptake is the method of removing the neurotransmitter from the synaptic cleft between neurons. Cocaine blocks monoamine transporters, which blocks the reuptake, leaving an oversupply of neurotransmitters and increasing their brain activity close to their receptors. Essentially what happens is that the dopamine can bind and continues to bind to the receptors on the postsynaptic neuron, which sends nerve impulse stimulation. By having cocaine block these transporters, the dopamine is overused and the brain is overstimulated, which is what causes the feelings of euphoria. Cocaine also increases the concentration of extracellular dopamine in the reward circuit.